Hello everyone. This topic is on urorectal septal malformation sequence (URSM), a rare congenital malformation. We'll see the fetal sonographic features of this condition in this lecture. Now, URSM sequence is a disorder of abnormal development of the caudal end of mesoderm. Typically involves abnormalities in the perineal openings, external genitalia, which is often ambiguous, and internal pelvic structures, including the anus, urethra, and the Mullerian structures. And the incidence is for 1 in 35,000 to 250,000 neonates. Why should we diagnose URSM sequence prenatally? It is a non-lethal anomaly with a long living span, but the quality of life is questionable because of urinary difficulties with urination, defecation, sexual function, and finally, very important, fertility. And involves even the child is born, child may have to undergo multiple surgeries, and the clinical spectrum is broad, extending from almost normal to a non-correctable features. So it involves counseling to a great extent, the counseling of the couple regarding their choices. If you would like to go through this lecture, please log on to sonochat.in and listen to the lecture. Thank you.